The birth of Christmas babies has been a time to reflect on the worrying trend of underage mothers in South Africa. A harsh reality in South Africa has been the prevalence of teenage pregnancy. In KZN so far, one of the youngest mothers who gave birth today is 15 years old. Let's bring in Dr. Sandile Tshabalala from the KwaZulu-Natal Department of Health for more on this, Doc. A very Merry Christmas to you. Thank you so much for joining us this afternoon. A number of teenagers gave birth in your province today. I mean, 3 15-year-olds, a 16-year-old and a 17-year-old, and the fathers of some of these children are as young as 19 and 23 years old. A very worrying factor here to consider, Dr. Tshabalala.
Firstly, good afternoon. Good afternoon to yourself. Good afternoon to the viewers of your program. But also Merry Christmas to you, Merry Christmas to the healthcare staff, and Merry Christmas also to the community of KwaZulu-Natal. We are correct, the society is worried, and the principals in particular and ourselves as the Department of Health are worried that the number of teenage pregnancies are increasing, but we also are worried by that most of these teenage pregnancies are teenage pregnancies that happen between a teenager and somebody who is very much higher in age than that teenage girl, so to speak. And it's something that we want to discourage. Unfortunately, it also comes with many other consequences on the girl herself, but also on the newborn and all the other people that are involved. It has negative effects, including, among other problems, the possibility of a cesarean section, simply because you are born when the pelvis is not ready to stomach or accept easy evacuation of a child.
So what responsibility, if any, does the hospital have when a teenager is giving birth within their premises and with a father who is, like you say, a lot of the times who are not teenagers themselves? Is there a responsibility for the hospital to report to social workers or something of that sort?
The first responsibility when a patient comes to us is to take care of the patient. But remember, we would be taking care of 2 patients in this case. So we take care of these 2 patients. We then engage the patient in terms of wanting to or not wanting to report. The reason we are saying we engage them is, while we think impregnating a teenager when you are very old is tantamount to rape. However, in some instances, you want to report these, and then you find that these young children don't want them to come for antenatal care, and as such, it puts their life and the life of the baby at risk. So we are engaging with this DSD, we are engaging with South African Police Services, we are engaging with human settlements as well, to say how to manage a case like this, because this is not a Department of Health issue, it's a societal issue. So as a society, we therefore need to speak to this matter and be able to say, how do we stop teenage pregnancies? How do we really prepare our youth and our young ones for the future? Because we look at them as the future of the country.
And also, it being a social issue, what are you finding, especially just amongst the patients that you have, it being some of the socioeconomic issues that lead to the factors of young children giving birth to children?
In a case, for instance, you've mentioned a few cases of today. You find that it is young ones who were just messing around, if I may use that terminology, and therefore they didn't really appreciate the consequences of what they were doing. But when you find them among teenager who has been impregnated by an older person, what we are discouraging is a situation where she tells you that the families have spoken about this. There is nothing to speak about. This is really something that is either incest or rape. So there's nothing to talk about. But also you do find a situation where the older male would have then gone to the the family of the young girl and paid for whatever that is paid as uklawula, if I may use the Zulu terminology. And that takes the case away from the SAPS. And therefore, at the end of the day, you find that it is difficult then to manage the case without the involvement of the mother and the family. But these are issues that we have decided to say, let us engage the traditional leadership, the traditional healers, and all the leaders in the province to say, how do we work and destroy this sketch that is looking at our society as a whole, not only in KwaZulu-Natal, by the way, but in the whole country of South Africa.
And then this, of course, then raises another issue, and that would be that of the prevalence of HIV and AIDS, especially amongst these teenagers.
Unfortunately, one of the possibilities is that this teenager would get involved in a sexual encounter with somebody who either knows their sexual status or do not know their sexual status. Whether they do or they don't know, the economics of that incident call for the child or the teenager not to be able to even negotiate that let us rather use a condom as we engage in this action. And therefore, it puts them at risk of getting infected with HIV, among others, getting infected with other sexually transmitted diseases, but also messing their future and the future of the newborn in particular. But what we have seen as a province and a country is an increase in terms of the number of syphilis cases. And usually when you check very well, it comes from these discrepancies in terms of age discrepancy and the pregnancies. So we are trying to therefore not only look at just the pregnancy, but also at teaching and being proactive in preventing all these diseases and all the other sketches that are finding their space in our society.
And talking about teaching, I mean, maybe just take us through if there are some initiatives that your department would have within the province, especially when it comes to sexual education amongst young children, maybe campaigns that you're taking to schools.
You will remember that KwaZulu-Natal and other provinces, I want to believe it's the same. There is what is called school health programs. In those school health programs, we do teach both male and female teenagers about pregnancy and about other sketches that may attack them. We also have partners in our province who also go to schools and educate about the same topic and other topic related to health. But we also are encouraging that the issue of contraception is free. It is free in all our clinics. It is free in all our hospitals. But beyond that, there are those contraceptives that you need to take them once in 3 years or even more. And we're encouraging our youth to go for those so that at least they don't get pregnant when they have not planned to be pregnant. Beyond that, the condoms are free. Remember, a condom will prevent you from getting to be pregnant, but also will prevent you from getting sexually transmitted diseases. So that duality in terms of prevention is also encouraged. All these are happening. We have also created youth-friendly services, men-friendly services, with a view of not only teaching the young ones, but also the men themselves. A question that I've asked in one of the sitting was, I was sitting with young boys, and I said, if I was to all of a sudden find my way having sex with your 15-year-old sister, and I'm telling you, I'm not concerned about her, all I'm doing is to just play around, how would you feel? That topic sparked a lot of debate, and we encourage those debates for them to realize that having sex at a younger age is not necessary, is not correct, but also impregnating is one of the worst in terms of killing the future of themselves, the girls that would have been pregnant, but also the child that would have been born.
All right, Dr. Tshabalala, thank you so much for your time and for joining us this afternoon. A very worrying fact there is we're seeing those Christmas babies being born, but many of them being born to teenage mothers. That's Dr. Sandile Tshabalala from the KwaZulu-Natal Health Department.